Hey, welcome back. Before we get this day done, we're going to talk about your foot health, and that means Dr. Mark Bradley, Brantford Podiatry Associates, are with us. Welcome back.
Nice to be back again.
Oh, man. You know, you didn't tell me what you're going to talk about, and I could literally hijack the segment right off the top because I got somebody who worked with me, and they were having a foot problem. They were sent to their MD, and I won't say who because I don't want to sue, but they got a prescription to go to a group that doesn't have podiatrists. And that killed me that a doctor is sending them to somebody who doesn't have your kind of training.
That's probably more a reflection of my profession than anything else, that we're not doing a good enough job at kind of educating. And I mentioned before, I had the luxury when I was trained back in Ireland, we did our training alongside med students and dentistry students, so they all kind of were already
your healthcare
better understood. But no, that's unfortunately more our fault than anything else.
Okay, well, I'm trying to funnel this person your way, by the way. So what's our topic today?
Our topic today is gout.
Really?
It's a ghastly condition.
Okay.
For those poor
is it on the upswing?
No, it's about, I think the statistics suggest about 2% of the population. I mean, certain groups are more prone to it than others, but it is quite prevalent. And when it goes off, God love them. Boy, did they know about it.
You brought pictures?
We do actually have a picture. There's see the big toe joint?
Yeah.
It's bright red. You can't get within 2 feet of it, otherwise the patient, utters, threats and warnings.
And you need a shoe with a sidecar.
Yeah, and for some weird reason, the body decides to target your big toe joint. It's not the only joint. It can affect just about any joint in the body.
I always thought gout was ankle. I always thought gout was the middle of the foot.
No, number one joint is the big toe joint.
Okay.
But certainly the ankles and other joints like that can be affected. What actually happens is normally uric acid we basically excrete as urine, and the body decides to cruelly store these little crystals, and they're little sharp crystals, and they store them within the joint, and they're very corrosive. So they physically and chemically destroy the joint from within, and it's just so painful.
Is it a foot problem or is it a urinary problem?
Well, it's obviously it's a problem with their it's a genetic thing. They're born with it. There's ways to manage it. Our concern is managing acute flare-ups and long-term protecting them. There's a few things we know. Dietary, there are things that will stimulate and activate it. Physical trauma will also bring it on. Like, God love him, I have a patient in our Mississauga office, and every time he plays soccer, which is interesting because he's his son's coach.
Okay.
Every time he kicks a soccer ball for a while, his big toe joint goes off and it turns into a flare-up of gout.
Doesn't feel it on contact?
No, the physical trauma stimulates the deposition of the crystals, or it makes the crystals break loose. Is
this a joint situation? Because I don't know if it's an old wives' tale, but I remember Mom and Dad saying, "Don't crack your knuckles, you'll get arthritis." And supposedly you opened up the joints and bad things happened. Are we opening up a joint there?
No, well, in this case, it actually completely destroys the articular surfaces, and it is very, very. It's one of the most aggressive arthritises out there.
Wow.
So as a result, some of our patients, when correctly diagnosed, their family physician will prescribe a medication to prevent that from flaring up. So they'll be long-term put on a medication, and they'll monitor that. That's not our job. We deal more with the acute situation where someone comes in and the poor big toe joints just ballooned up and bright red, and we manage the acute situation, get them comfortable, and refer them back, and their endocrinologist or their GP will take over from there.
So you got the medicine part. How do you keep that person comfortable, that toe you're talking about?
Well, again, the usual story. If there is an ongoing mechanical irritation, then we do our damnedest to take it away.
Right.
If the joint is that physically deformed as a result of the effects of the arthritis, then we'll make sure their footwear is adapted so the actual shoe itself not physically irritating it and making it more problematic.
I'm going to go full circle, and thanks for the great information. I'm going to finish where I started. So if my doctor says, "Oh, I got a problem with the foot, I've got to send you to somebody," if they hand me that referral, do I say, "Is this a podiatrist? Is this a chiropodist?"
Yeah, I mean, either podiatrist or chiropodist. At least you know that you're going to get assessed fully, and you'll have the right information. You can make a decision to go forward from there.
Dr. Mark Bradley, thanks as always.
My pleasure.
We're going to come back. We're going to be here.